Kaitlin Edin holds a Bachelor of Arts and Bachelor of Health Science in Traditional Chinese Medicine, a grad diploma of education, a diploma of remedial massage, a Manaka certificate, and a Toyohari certificate. She began her studies informally in Japan in the late 90s and completed her formal training in Australia in 2008. In 2013, she finished 3 years of extensive postgrad skills-based training in meridian therapy and classical acupuncture. She is now working towards certification with the Si-Yuan Balance Method and deepening her studies in the advanced classical traditions. Kaitlin is also a director of ANTA, Australian Natural Therapies Association. Kaitlin, thank you so much for joining us. We're thrilled to have you.
Thank you for having me. It's wonderful to be here.
Welcome indeed. One of the primary reasons for me launching Pure Health Hub was to remind all of us that while medical research and, of course, subsequent medicine development is more about wholly and solely fix what is broken, like really broken, and can have miraculous outcomes. There's no doubt about that. But there are often significant side effects using pharmaceutical intervention, which is not to say don't, but to be sure to do what we can do to minimize these side effects. We need to make sure we're minimizing those side effects. So by balancing them with some natural therapies, clean diet, etc., and even better yet, take a more holistic approach to our health and stay ahead of any health issues to enable treatment before they become life-threatening. So, of course, holistic health is what we're trying to share with our readers and with our audience. So initially, could you just briefly summarize what is known as traditional Chinese medicine?
Okay, well, that it's kind of like how long you got.
I bet.
For a really small summary, look, Lonnie Jarrett is one of the many great teachers in the tradition, and one of the things that he says is that Chinese medicine is really the art and science of catalyzing human emergence. Now, I'll just say that again. It's the art and science of catalyzing or bringing forth or transforming the nature of the human. So the human emergence. So that's consciousness, that's awareness, that speaks to every level of us. If we're talking holistically, that speaks to our psyche, our emotions, our body, our social health, our mental health, all of those things. So that's a kind of a crystallization of it. Of course, it's such a diverse practice, and everybody brings to it something of their own. So I feel a little bit like, oh yikes! I've got to sort of summarize a whole tradition. I might be in trouble here.
Yes, yeah.
but I guess to sort of answer it, obviously without being facetious, it is an art and science, and that combination is often something that we don't immediately kind of recognize, or we don't immediately get everywhere else. So medicine is in fact an art, but it's been so stripped back to the science in the way that it's practiced by so many that it's lost a lot of its embodied wisdom and consciousness. So I think Chinese medicine in that sense is in some way has a fuller tradition, or a fuller sort of response to that.
Yeah. Well, I think that then comes into that holistic health approach, right? Which is perhaps where that holistic approach came from, because all of these things, the consciousness and the physical and all of these other things really have an impact on our physical health at the end of the day, right? So how would you define holistic health then? I guess you kind of have, but when someone says holistic health, how would you define it?
Well, I mean, if we're talking about the whole person or the whole body, then we have to be kind of, I mean, in a way, it's a bit of an it's a bit of a truism. It's like, well, we're talking about the whole person. So what does that mean? Well, it means the social, the cultural, the emotional, the philosophical, the psychological, the physical. It actually is the broad, it's the broad kind of spectrum of our lives. And if we're, for example, if we're suffering from something like DV, that is a huge issue that is going to affect every level of our health, every level of our consciousness.
What do you mean by DV?
Sorry, I mean domestic violence.
Domestic violence.
So,
yeah.
So if we look at something from a social point of view, so this is a social problem, right? We don't necessarily think about it as a medical problem, but it absolutely informs how, as medical practitioners, we need to understand the body, how we particularly need to understand women's responses to themselves, to their health. So, I mean, I don't want to sort of necessarily, jump into that issue, because that's a really massive issue. But it's about sort of saying, actually, the context of our lives. So everything that informs us, everything that we have an experience of, this is part of our health, this is part of our well-being. As you know, I mean, that most of us get that,
I'm not sure that we do, to be honest. I think in my experience, I mean, I think we get it. I think intellectually we get it, but do we operate in that space? I'm not sure that we do. So I think that's why I kind of wanted to remind women about taking that holistic approach. That's not just walking into the doctor and going, this is what needs to be fixed, and to fix it we need to address these things before they get too bad. But your medical, your social, your mental, your social, as you say, cultural, all of those impacts, and also any obviously past trauma, right? So I think we need to remind ourselves that all of these things have a massive impact on our physical health.
They absolutely do. Can I just say on that, that often, but often what happens is that we compartmentalize as a way of both controlling and also coping, and that's absolutely okay. And so sometimes we pull one thread from somewhere, and suddenly the whole ball of wool comes with us, and we think, oh, right, okay. And that's holism, right? If you're treating holistically, so it can be messy, it can be time consuming, but it's also deeply enriching as a practitioner, but also as a patient, as a client. So it's yes, we want to have a holistic approach, but sometimes we don't always have a way of being able, if we look at it in the whole, it gets too much. And so that's why we tend to look at it in small little bits. Like, I just want you to fix this. I just want you to fix that. And that's okay. That's totally okay, because that's really telling us what actually if I'm coming as a client or a patient, if I say to somebody, I just want to deal with this, I would hope that my practitioner was able to recognize that what I'm saying is, actually, all I can manage is this bit, and if you help me with this bit, we might be able to do a bit more, but just help me with this bit first.
Absolutely. Yeah. That's true, but I think, of course, that's very difficult to get from our poor GPs. Often it's, fix this, but we'll get to that. But I do want to sort of remain on this this piece about women suffering from PTSD and trauma-related anxiety and depression. In what ways then, while we're on that physical sort of manifestation, what ways do you see women presenting with trauma? So when we talk about that, you'll say, someone will come in and say, oh, I'm just suffering these headaches. But what are some of those things that they're presenting with that you find that are related to past trauma?
Well, I mean, it's as diverse as women themselves.
It's just an example.
It's as diverse as the trauma itself, and often so with trauma stuff, I'm not making any judgment, or I'm not sort of saying, oh, this is trauma and this isn't. What I'm responding to whenever I see anybody is, well, what are they presenting with? And maybe it is just a headache. Maybe it is just back pain. Maybe it is just a really sore neck. Maybe it is just a sense of heaviness, or a sense of being unable to get out of second gear. Maybe it is just that, and maybe it isn't. And so it's about being open to the possibility that it could be coming from somewhere else, but even that understanding for some people is too threatening. So I don't always have that conversation, but as a practitioner, I'm always looking at, okay, so we've got a headache, and I've seen you for 3 times now, and the headache has kind of changed, and but it's still there. Okay, so what's really happening now? So sometimes it can just be, oh, I've had a bad day and the kids are getting on my nerves, and I've got 15 million things to do, and and then sometimes you can interrogate that a bit deeper, and it goes a bit deeper. But all of those things sort of have their own organic expression, and they have their own organic timing, and I can't bully that. I can't pressure that. All I can do is be open and receptive to what might be there, and then have some things up my sleeve as a practitioner that give me options to assist someone. So I do a lot of the somatic stuff, headaches, body aches and pains, and then there can be other more sort of systemic or internal problems. So ongoing issues with the hormonal cycle, or blood sugar imbalances, blood pressure imbalances, those kinds of things, vagal, vagus nerve sort of stuff. That can often be a big indicator of something else is going on.
Yeah, exactly. So it's not always necessarily trauma. It can be, as you say, particularly as we're getting to a certain point, the hormones can start to go haywire. So it's a bit of an investigative job, isn't it, really?
It is. Yes, it can be a little bit forensic, but it's also curious. You do have to have a level of curiosity as a practitioner, and you have to like people, you have to sort of think, oh, okay, what's going on here, and how can I be of help to you in that way? So, but it's also about being imaginative.
Yes, exactly. And I guess it comes from that experience as well. Well, I guess then, you talk about trying to delve deep into someone's psyche, which is never easy. What would be some of the modalities? So how does TCM and its modalities work? And I guess we incorporate, acupuncture and herbs, but what other modalities are there?
Okay, so Chinese medicine is the broad umbrella term, and then underneath that there's a range of practice, a range of sort of modalities or techniques. So acupuncture both as an insertive practice, so putting pins in people, in muscle and in skin and fascia, and obviously the herbal medicine. And then you have a range of other techniques like moxa. So moxa, it's in the Japanese tradition, moxa is an entirely its own thing. So in Australia, it's taught as a sort of an adjunctive therapy to acupuncture as the main therapy. But in Japan, particularly, the specialization of moxa has really taken on a whole life of its own. So it's the burning of mugwort. And it's sort of, that's another whole, it's not a whole rabbit hole if you want to go down there.
Well, I'm curious I'm curious though about that. Like what can you give us an example of what you might use that for?
You can use it, so you can use it to reduce a fever. You can use it to reduce a headache. You can use it to what we would say is move blood or move stasis. And different forms of moxa are used for different things. You can, if somebody has digestive problems, they're vomiting or like morning sickness, you can use moxa sometimes if they're not too sensitive to smoke, because it does require that there's a little bit of smoke. Not always a lot, but a little bit. In the Japanese tradition, that smokiness is not considered problematic. and it's usually very high grade of moxa. So a lot of the moxa that we get here is not a good quality, and so it's really pretty stinky. But the traditional or the classical applications of moxa are beautiful. And interestingly, smoke has a response in our well, because it's an olfactory sense, right? We're smelling it. Smell goes directly into the limbic system, and it helps us process emotions. So right. I also use essential oils within a Chinese medicine paradigm, not within a Western aromatherapy model, but within Chinese medicine. And that there's quite a strong history of that. And for the same, I mean, obviously it's different. You're smelling different things, but smell is very powerful. It's a very powerful way of engaging the emotional body. And so smoke, or that smell of a campfire, or that smell of, a smoky autumn day. This can be very sort of conducive to people letting go or integrating or just experiencing something else. Yeah. So that's why moxa can be very helpful as well. It has other functions, but yeah.
Yeah, but that's what you would perhaps use it for. So it's a therapeutic option, as well as, I guess, a psychological, because it as you say, it induces thoughts, memories, evokes experiences.
Yeah.
Okay. Wow.
But it's also, because it's considered, actually the Anglo-Saxons considered moxa to be one of the 9 sacred herbs. So it has a very large tradition. It's not only Chinese medicine. It was actually used in other parts of the world, and it has a sort of insecticidal sort of aspect to it. So it will, in that sort of that tradition of either the shamans or other sort of maybe First Nations, where they do a lot of smoking ceremonies, they use smoke as a way of clearing, of cleansing. Moxa has that capacity as well. It has quite a strong capacity to heal, to cleanse, to get rid of little insects and things like that. Yeah. So it's
any other sort of techniques or practices or?
Yeah, so we do a lot of manual therapies like gua sha. So gua sha is a frictioning technique that we use, and it's often called the Graston technique by other traditions, but it's essentially a fascial frictioning technique. It's very, very helpful. Cupping, and cupping, there's a whole range of applications that you can use that for lots of people. So children, the elderly, you can use it with women who are pregnant. You have to be very careful, obviously, but
So fundamentally, what does cupping do? I know I appreciate it treats many issues, but what does it do? What does it bring?
Okay, so straight cupping can help to, say, for example, if a kid's coming down with a slight, they're starting to get sick, you can do either some moxa, some cupping on their back and sort of innovate, and invigorate what we would call their wei qi. And they're defensive qi. It can be used to kind of bring the cold out of the body. It can be used to, it's often glass cupping and fire cupping is often used sort of to bring out deep stasis in the so often people who are sports people, you've often seen cupping marks on our swimmers and other athletes, and it's a way of sort of just getting the blood to move in the muscle and in the area that they want to. So it can be quite useful.
Oh, fantastic.
It's about application.
Yeah. It's enormous. So so going through then, when we compare, and I'm not trying to compare conventional medicine, but as we said before, conventional medicine can induce side effects, and quite often it does. Is that the same for Chinese medicine?
If by side effects you mean, if you mean,
I mean, I guess longer term side effects, or even immediate ones, like, I don't know, the sweats or the, you know, anything that obviously there's a reason you take it and you still need to, but I'm just saying it's, you know, any kind of side effects that you would know, headaches or sweats or anything like that.
Look, I think sometimes there can be side effects, are often unintentional consequences of treatment. You know, you don't really want to be feeling like that, but it's had this unintentional sort of effect or consequence. Chinese medicine, if it's applied properly, no, not generally. I mean, it is about application, and I actually can't stress that enough. The medicine is a kind of in some ways it's inert. It's how you handle it. It's how you apply it. So in that sense, yes, you can do some. If you're not applying it correctly, you can.
But I guess
create.
But I guess we're talking about the actual products themselves, and not really, if they are applied properly, they're not really designed to you know, they're not going to have some side effects.
Not really. I mean, I think if you're talking about herbal medicine, that's a different discussion, because herbal medicine will have an internal, you know, pharmaceutically or pharmacologically defined effect. And so you can get into a bit of trouble with that one. But a lot of the sort of the somatic or the body therapy stuff, not really. I mean, but that's about having a conversation with your client. You know, if they're sort of, if after treatment they're always getting inflamed, or they're always having a headache, then you have to be thinking, oh, that's not usual. What's happening? Is it something I'm doing, or is it something that I've missed? Or but not usually.
No, exactly. All right. Well, traditional Chinese medicine is, of course, steeped in tradition and ancient practices. Yet you consider yourself a practitioner with a classical leaning rather than being a traditional. What do you mean by this?
Oh dear, this is a bit of a political. You're throwing me a political live wire here, Lindy. Come on.
All right, you said it. Well, you know, just what I mean on a top level, just what is it like? Obviously, to me, traditional Chinese medicine is just that, traditional. And I do wonder whether or not we've come forward in leaps and bounds over the last 300 years to bring it more into, or adding sort of adapting it to more modern times. So what I'm trying to understand is, what has Chinese medicine adapted and, you know, implemented a whole bunch of other practices and herbs, even, you know, to adapt.
Look at has. I mean, and in a way, the way that we understand health is about adaptation, right? So if you have a medical practice, you have a medical paradigm that's not adapting, it's not going to last. So there's always adaptation, there's always change, there's always transformation. And part of that is through the practitioner's skill and capacity. And it's also about a community of minds and a community of people getting together and researching stuff. And you know, that's a wonderful kind of feed in to how it does adapt and change. I guess to answer your question about traditional, it actually really doesn't indicate that sense of as a term. It doesn't really speak actually to that process of evolution. Actually, traditional speaks to quite a static understanding of, oh, this is traditional, so therefore we don't change it. It's like, no.
That's right. Exactly.
Yeah. Classical really, I mean, in its in its most obvious sort of understanding means that it just refers to the classics, right? So we have classics of the medicine, and these are very old classics. They're thousands of years old. Some of them are not that old. Some of them are only 600 years old. Only 600. And so, but what we do when we're sort of really talking or making the distinction between traditional and classical, and it is actually a very big conversation, but we're really sort of saying, if I'm classical or if I have classical leanings, then I'm going to the classics for answers. I'm going to how did they actually discuss it then, and what can that give me for now? And it's kind of extraordinary that something that was written 2,000 years ago can have such relevance to us today, and it really does. So that's I hope I've answered that question without getting myself into too much trouble.
Right? Yeah. Well, I guess physiologically we haven't changed too much, so
No.
I guess it's we're still looking at the same challenges, maybe some different ones for more modern times. So then now I guess I want to talk about specifics, and we did talk a little bit about suffering PTSD or trauma. What about chronic pain and working with chronic pain? Again, pharmaceuticals, they're fine, they work a treat, but they're really just for episodic pain, right? So if you're living with chronic pain, it's something that you live with every day. So how can Chinese medicine, assist for treatment of chronic pain? Because obviously it can be a psychological as well as a physical manifestation of pain.
Yeah, look, anytime you've got chronicity, you have an engagement with something more than just the physical body, usually. You can have a chronic condition that you don't necessarily recognize yourself as chronic because it doesn't get you at that deeper emotional, psychic level. Right? The way I understand it is I actually draw on quite a lot of Celtic philosophy and understanding. The Celts talk about the soul as, so when we talk about the soul, often we tend to think of it as this little seed inside the actual body, the physical body. Right? But the Celts say, no, the soul is actually bigger than the body. The body is actually in the soul. Right? So when you look at it that way, when you just for a moment conceptualize the idea that the body is actually held in the soul, right? The soul is bigger than you, then what the body is, or what you can understand the body is the expression of the soul. And that's the way the Celts would think about it. And the Celts and the ancient Chinese had quite a lot in common, it would seem. And so often chronicity or chronic pain is, if there's a very sort of structural reason for that, then that's that's
a motorbike accident or something, then clearly,
then maybe there's not so much, but that sort of understanding, you just try and alleviate the pain however you can. And look, purely and simply from a physiological point of view, Chinese medicine says pain is due to stasis. Pain is due to things not moving, right? So if you don't move, you don't transform, you don't transform. And because of that causes pain, ultimately that causes death, right? Because the death of a cell or the death of a, so, or dead blood. We talk a lot about dead blood in Chinese medicine. And it's really just that things are not moving, things are not working at their best, they're not working the way they should. And so what that means is we've just got to try and work out how we move it. So cupping, gua sha, moxa, acupuncture, maybe that it's just a simple matter of just getting that stuff to move. Yeah? But then there's also the movement in the psyche or the emotions of the mind. Like if you have grief that's stuck in you, that's going to cause pain. Yeah? And And sometimes even just opening up that conversation is enough. That's all you have to do. You don't, in fact, sometimes you don't even have to do that. You just have to touch something in a particular way and somebody will burst into tears. You know, and
right there, right? It's just the surface.
Yeah. Or they'll have a different response. Sometimes they giggle. You know, they absolutely wet themselves from laughing. You think, God, I didn't expect that. So you know, in a way, you have to hold all that. You have to sort of and you have to see that that's absolutely okay. That whatever comes out of the body in chronicity is a normal response. And it's often practitioners' responses to emotional outpourings that are in fact the problem. People tend to want to sort of make it better, and it's like, no, just don't do anything. Just sit there and hold it. You know, I saw this wonderful meme. It was a picture of somebody's dog, and they were saying, why is it that my dog just sits there and I feel better being in his presence? I thought, because he's a dog.
Yes. We know that they're they can be a great healer.
That's right. So in a way, you just have to be like that. You just have to kind of go, okay, all right, that's just happening. That's just going to come out. That's all right.
Well, exactly. And it's a trusted space too, right? So it's holding that in a very trusted environment. So I guess when you're dealing with chronic pain, it's more, you probably look more on the emotional side than you would from, you know, any kind of treatments or techniques or.
Look, you employ everything. I mean, you throw everything, not that you throw everything at it in a kind of willy-nilly sort of, I'll just sort of make a mess of the kitchen kind of way. You bring every nuance, you bring every wisdom, you bring every embodied capacity that you have in terms of your understanding. And I think the other thing is too, and this is, you know, I see this with our young practitioners, and the younger they are, particularly if they haven't had chronic pain, they don't get it. You know, when you've had chronic pain, you get it in a way because it's an embodied experience, right? So you get it in a way that just enables you to sort of meet someone in that place. And sometimes all you want to do as a patient or a client is just for somebody to get it. And how you get it, what you then apply, in some ways is sort of, it's not irrelevant. It is relevant, and you do have to be very clinically proficient, but it's not the technique that is going to do it. Actually, it's the soul that does it.
Yeah, exactly. And I think. I was just going to say something. And I totally understand. So it is about obviously looking a lot deeper than just those, than just the sore finger.
Yeah, I mean, if there is a structural reason for it, then you may not want to be probing at that. But you've got to let. I very much do nowadays. I have seriously got myself into some hot water as a younger practitioner. I let people lead that discussion. If they have a recognition or they want to talk about, you know, an emotion that might be part of that chronic pain, then I open the space for that, but I don't push it.
No. And I think, as you were saying before, what I was going to say was, you know, you're saying if you haven't been through it, it's very difficult to then practice and focus on it because, and it's true, and it's a little bit why we've developed Pure Health Hub, because really, unless you're sort of going through these health and hormones and all of these things, it's very difficult to understand. So totally agree. Yeah. So there's a couple of terms in Chinese medicine that I was hoping you could just clarify for us. I mean, they're not something we all haven't heard of, but I think we're just hoping to get just a little bit of clarity around them. So you talk about clearing heat.
Yeah.
So tell me a little bit about that.
Okay. So heat can be, heat is what? Heat is inflammation. Heat is fever. Heat is some kind of, hormonal chemical response to something. So how do you clear heat?
So it's the ailment, right? So the heat, clearing the heat. Obviously, when you have inflammation, you do have heat. So it's quite literally the heat. So it's clearing that heat.
Yeah.
So that's by deploying those practices.
So yeah, look, that's right. I mean, what you want to do is the practice of Chinese medicine is really about if it's hot, you make it cool. If it's cold, you make it warm. If it's dry, you make it moist. If it's too moist, you make it drier. It's a sort of
finding the right balance,
oppositional, right? But it's pretty close,
And that's, I mean, you balance, the term balance is used frequently. So yeah. Is that what you're trying to find, that balance, which I guess leads us to qi. I mean, you want to just talk through the qi. What is qi?
Qi. Well, what isn't it? What is it not? Is perhaps the better way of answering that question. I'm sorry. It's such a massive question. Look,
when someone's, I guess just trying to make it just simply what is, and I know it's not easy. What is qi? So qi is your overall.
Yeah, I mean, I was being a bit facetious, but I'm actually going to stick with that response. Like, what isn't qi? So in a way, we can say everything is qi. Qi is just it's a kind of a unit of, it's a unit of energy. It's a description. It's a thing. It's a whole embodiment. So, and of course, in Chinese medicine, we can get very specific. So we can say your defensive qi, your spleen qi, your heart qi, your lung qi. So, well, what does qi mean? Well, qi is it often translates as energy, but even energy can be a bit it doesn't nail it.
But something that we would understand would be energy, I guess, which is probably, would you say that, or is it something more to it than that?
Well, there is more and there's less in the sense that, I know, and I'm going to sound like some crazy person, right? I often think about it as information.
Yeah.
So because qi can be the actual energy that comes from a cell. Right? So the energy that comes out of an actual living cell, the Chinese would call the motion and the dynamic and the engagement in that cell. They would talk about that as qi. Yeah? But then, and so all of that is about information. At some level, you're looking at it and going, well, there's a whole lot of information there, but how do I make sense of that? Right? If we talk about spleen qi, we can talk about it as spleen information. If we look at it that way, it's like, okay, what is the spleen, or what the spleen does for us, which is, filters blood in some ways, but is also kind of shorthand for the pancreas and for blood sugar and all of that sort of stuff. So what does the information about the spleen tell us about what's happening? Is there a problem with hormones or with blood sugars? What's the lung information? What do we need? So it depends on what you're talking about. It depends on, in Chinese medicine, things are very relational. So it's like, okay, what are we talking about? Then we can start to define what qi is. But look, it's a way of sort of saying energy, spirit, embodiment. It's all of those things and much, much more. Yeah.
Wow. Okay. So, all right. Then, okay, maybe this might be a little bit easier. I'm not sure. Okay. So we talk a lot also, as Westerners talk a lot about the yin and yang, and I don't think it's probably correctly. Can we be deficient in either or both? And what happens if it's imbalanced?
Well, the answer is yes, we can be deficient in both. So yin and yang they are complementarities. So one does not exist without the other. Yeah. There's a beautiful Japanese understanding that comes from ceramics, and they talk about it as ma. And ma means the negative space around thing. Yeah. So we tend to look at a person, a chair, a thing, right? We tend to look at that thing and go, oh, well, that thing has beauty, or we judge that thing. Yeah. And that would be so what we're looking at is so if we're looking at a vase or a chair, that is the positive thing that we're looking at. This is the yang, right? This is yang, because it has a level of, let's just call it yang. And then around that thing, just stay with me. Around that thing is what the Japanese call ma, and this is the negative space. They talk about it as the negative space, right? So it's almost like once you take that chair away from what if you take that chair away, you're not looking at the chair anymore, but you're still looking at the space around it, right? You're also looking at the space around a thing. And the space around it tells you something about the thing itself. So I can look at you, and I can look at you in your positive aspect. And then if I just sort of slightly soften my gaze, I can look at the space around you. And this space tells me a lot of stuff, actually. Yeah, about you, right? But it's a very... So what I'm trying to get at is that this is this idea of yin and yang, right? So they're complementarities. We all take up a space, and we are both that positive aspect, and then the space around us is the space that holds us, right? We call it negative space, but it doesn't mean that it's negative in any sense. It just means that it's not the positive aspect. And so this is yin and yang. Yin and yang are about complementarities. They originally, yang was the sunny side of the mountain, and yin was the shady side of the mountain. And this is where it comes from. So we have already, this is a polarity, right? It's a polarity. It's a 0-1, right? It's a way of being able to look at the essence of something in a way that describes it and doesn't nail it.
So, okay. So can you give an example of what an imbalanced yin and yang would be? Like just a brief, if it is imbalanced and you're more positive than negative or whatever, what would that look like? How would that look in somebody?
If you're wanting to translate yin and yang into medical terminology or into medical application, it can mean, so for example, somebody might have a very cold abdomen, right? Their abdomen might be really cold to touch. Well, then we would say that there's too much yin there. It's too cold. It shouldn't be cold. It should be warm. It should be soft. If it's too hard, well, maybe it's also too yin. How much it tells us about what we want to do, it's a very, in some ways, and we use it diagnostically. We do, because in the early days we have to work out, well, is it hot or cold? Is it black or white? Is it But then, so actually, the yin and yang symbol that everybody's fairly familiar with. This is just the representation, and it's a static representation. But what you actually need to understand is that is constantly moving, right? So that circle of the yin and yang, where you see the black and the white shape with the little eyes of each different color in it. This is the static representation, but actually you need to think about that in your mind as moving, right? So yin and yang are constantly in conversation with each other. They're constantly talking. So sometimes, yes, it's too yin, and then it'll go to, but what happens is that when something is too yin, it goes to yang. So it flips. It flips. So if you're really cold for a long time, all of a sudden you'll get really hot. And that can sometimes be what happens for women when they go through midlife and go through menopause, is that they're what we would say, they're not that they've been too cold actually, but that there's been this sort of stealing or thieving of their yang qi, their strong dynamic energy. And then you get to this point where you've either suppressed it or used it too much. And then actually what happens is that you just get really hot. Get hot because you don't have any more of it left, which is kind of sort of counterintuitive, but it's a very, I'm getting probably a bit too medical at that point, but
no, I get it though. That, I mean, it helped me understand a little bit about that yin and yang, because I think, we talk so much about it, we really sort of didn't understand it. But look, obviously Chinese medicine is incredibly rich and deep in terms of what it can do, and so is sort of normal medicine, but I think clearly there is so much involved, and when you're seeing somebody, if you're going to a practitioner, it's obviously not just about going for one trip, one size fits all, here's your medication, off you go, here's your herbs. So what would you advise somebody that was planning a visit to a Chinese practitioner for the first time? What would you advise them to go armed with?
Okay, so first of all, go to somebody that's either been recommended or is absolutely registered and has all the right qualifications. Try if you're fairly adventurous, and it also of course depends on what you're taking with you, what you're taking to get fixed or get worked on. If it's a long-standing issue or if it's a very specific issue, you might want to choose a practitioner that has slightly more experience. If you're going for a musculoskeletal stuff, sometimes treatment is very perfunctory. It's like, yep, that's good, that works great, see you next week, or see you in a couple of weeks, yep, terrific, or I'll see you when it gets bad again, that's fine. It's just that because there is such diversity in Chinese medicine, and in a way I am probably not a good representation in some ways of the sort of standard Chinese medicine. I tend to do a lot of work, because I do a lot of work with the psyche, I do a lot of work with trauma, I do a lot of work with that really deep stuff. I tend to practice in a very different way. It's not to say that I don't practice, with the body, I do, but I'm not a typical kind of practitioner, I suppose. So what I'd say is be open to it taking a little bit of time. If it's been something that's been there a long time, don't expect a silver bullet. It's actually, in a way, to get the best out of Chinese medicine, it's about saying, I want to begin to have a conversation with myself about what might be happening for me. Yeah. And that'll resonate with some people, and other people will just be like, whatever, can't be bothered. And that's fine. It has enough diversity that if you just want to, if you just want sort of a massage and a few pins in, that's fine too. You can do that as well. It has a very sort of
being able to communicate what those challenges are. And also, what about sort of taking things like, obviously, a list of what you're taking, in terms of medication or supplements or whatever, but also perhaps what your diet, would you take something in like what they've been, an example of what their weekly diet might be? Like, is that helpful?
Look, it is, and it's again, if you are going for digestive problems, then people are going to be talking to you about, okay, what are you eating, when are you eating, what makes you feel good, what makes you feel crap. But yes, there is a strong tradition of Eastern nutrition that is, again, it's based more on the 5 elements. It's based on particular cooking techniques. So it depends. Some of that stuff is very cultural, and food is really cultural, right? Like, food is a big cultural engagement, right? So I don't tend to I tend to take account of it if people tell me about it, but it really just depends on what you're coming for. But certainly people might ask you, they might say, oh, what are you having for breakfast and lunch and dinner and, that sort of stuff.
I guess it depends on what the condition is, but do
it
you research, obviously?
Yeah, for sure. I would absolutely say if you are taking medications and you then take that along to your practitioner and don't expect them to know exactly what they are straight away. You might need to just sort of let them know, because that's not, we're actually, most Chinese medicine practitioners at some level are translators. They're translators between a Western body and a Western corpus of knowledge and an Eastern approach. And so, yes, we're practitioners, but we're also all at some level a kind of translator. And so you can't always think, oh, well, they should know what that is. It's like, let them have a bit of time to work out what that is. So, yeah. but do tell them, because it is important.
It sounds like you have enough to get across over however many years it is, or 6 years or something, in training and ongoing, isn't it?
Yeah.
Kaitlin, it's been fascinating. Thank you. Thank you so much for joining us. I mean, I've probably got more questions now, but we can do that another time, right?
It's been wonderful to talk to you. Thank you for really being patient with me.
Not at all. It's been an absolute treat to chat with you. Thank you so much for joining us on Pure Health Hub.
My pleasure. Thanks again.